Mandatory questions on musculoskeletal system. M1800.
This question discusses patients' current ability on grooming. Tasks considered under this question include ability to access the sink for washing the face and hands and to perform dental and denture care, ability to access the cabinets and drawers to obtain implements such as toothbrush, toothpaste, floss, soap, comb, hairbrush, razor, shaving cream, aftershave, nail clipper, and makeup items needed for grooming, performing face and hand wash, dental and denture care, flossing, combing and brushing hair, applying gel, shaving, applying facial and makeup, and trimming finger and toenails. This question excludes evaluating an individual on tasks of personal hygiene such as bathing, shampooing of hair, and toileting hygiene. These tasks are evaluated on separate questions as discussed below on this topic.
Answers for M1800.
This is a single response question for which choices are provided indicating patient's independence and a varying range of caregiver dependence. Choice 0 on the question indicates patient to be totally and safely independent on all the tasks listed under grooming. Choices 1 to 3 indicate a patient needing caregiver assistance, with the level of caregiver dependence progressively increasing as we go from choices 1 to 3. Choice 1 indicates inability of the patient to access majority of the grooming implements, but once the implements are placed within reach, the patient is able to safely complete the task. This patient does not need any caregiver assistance during actual performance of the grooming task. Choice 2 indicates a patient needing higher level of assistance, which is assistance during task performance, such as caregiver applying toothpaste on the brush or helping with the shaving, or even offering verbal cues. This patient, despite receiving caregiver assistance, still actively participates in performance of the task. The last choice on the question, choice 3, indicates patient to be totally dependent on caregiver assistance for grooming. This patient practically has no active participation on grooming and thus is totally caregiver dependent. Clinician must consider all the limitations an individual could have towards safe and independent performance on grooming, while picking the appropriate response. For patients with varying abilities at performing different tasks under grooming, clinician must pick a response that best describes patient's performance on majority of the tasks. Patients who are safely independent at more frequently performed tasks under grooming and need caregiver assistance for less frequently performed activities are rated high on performance compared to patients who are vice versa.